My name is Jason Putz. I'm a physical therapist at Physical Therapy Solutions in Dyersville, Iowa, as well as in Manchester, Iowa. Today we're going to talk and discuss a little bit about compartment syndrome. Compartment syndrome is when you build up pressure in the lower leg. There's only so much space in there, and when you build up the pressure, it squeezes down on the nerves and the blood vessels around there, and it causes pain in the lower leg. As we can see on this picture here, this is the lower leg, and this is a view of the whole lower leg. And most people will get kind of muscle tightness in the back of the leg as they start to get pressure built up into that lower leg. We're going to go over to this cross section over here, and this is a view of looking crossways through that leg, and you can see that there's different compartments in here that are bordered by fascia, and that fascia doesn't allow a lot of swelling to leave that compartment. So if you get some swelling into this posterior compartment, it can cause pressure in there. And then as we come down into this next view, you can see that these muscles, again, if they get swelling, cause pressure, you have nerves, arteries, and veins that are in there that get squeezed. And once they get squeezed, they basically put pressure onto that nerve, causing pain. If that muscle tension and pressure is there for a long period of time, we can cause severe and long-lasting damage. So if anybody gets a contusion to that lower leg, we're definitely watching them and monitoring them very closely, because if we do get a buildup of that pressure in there, they can kill off that nerve and cause a foot drop into their leg. Most of the time what we see in physical therapy is called exertional compartment syndrome, where somebody is running for a long period of time and they just get muscle cramping and they're not able to go any longer. If they rest, it goes away, and that's kind of a cycle that continues to happen. With therapy, we try to stretch out some of that tissue in there to try to get them to be able to function a little bit longer periods of time before that pain comes on, and sometimes we do have to prescribe complete rest as well. If you have any other questions about compartment syndrome, please give us a call at Dyersville at 563-875-8615, or at our Manchester clinic at 563-927-1499. You can always look us up on the World Wide Web at www.ptsiowa.com, and you can always like us on Facebook. Thank you.